it's Dr. Spencer Nadolski here, and I got another question from my reader, Derek. He asks, do I need to avoid gluten to be healthy? Now, this is a very common question, and I get it all the time. I see it on the internet, I see it on Facebook. Lots of people hate gluten, demonize it. The answer, again, I'm always in the middle. You got to ask yourself some questions. Number one, do you get symptoms from eating gluten? You got to take a nice dietary record and just notice if you get them. If you do, you may want to talk with your doctor because you want to make sure you don't have celiac disease. That's very important. It's an autoimmune disease. You also could have irritable bowel syndrome, and that could be causing your symptoms. You could also have something called non-celiac gluten sensitivity. Now, here's some other things that you need to ask yourself. Do you have another autoimmune disease, like a thyroid problem, or diabetes, type 1 diabetes, or a few other things, rheumatoid arthritis, something like that? Do you have a family history of autoimmune diseases? These are all very important questions because I tell you what, gluten is associated, celiac disease is associated with autoimmune disease. So if you have another autoimmune disease, you may want to avoid gluten. Now, if you obviously have symptoms from it, you may want to avoid it, but I would definitely talk to your doctor and get the right testing. This reminds me of a story. I was with one of the gastroenterologists. He's a GI tract specialist physician. He was with a patient, and he was getting frustrated because the patient just claimed that they had celiac disease. They were convinced they had celiac disease. They did so many batteries of tests. They all came back negative, and the patient was still convinced that, nope, I know I have celiac disease. And the doctor got mad and was just like, no, you don't. And he wanted to kick her out of the practice. And I told that doctor, I said, well, what would it matter if she did avoid gluten? Nothing wrong is going to happen. As long as you're eating a full array of foods, vegetables, fruits, and good quality meats, you're going to get all the vitamins and minerals you need to have a healthy life. So if you want to avoid gluten, go ahead, do it. But if you don't have an autoimmune disease, you don't have a family history of autoimmune disease, you don't have celiac, you don't have irritable bowel syndrome or non-celiac gluten sensitivity, it could be speculative. I'm not in the camp that says gluten's bad for everyone. There may be some evidence and data coming out that shows otherwise, but right now I think just stick to those categories. Celiac, non-celiac gluten sensitivity through a journal and negative celiac testing. Also autoimmune disease, and maybe even a family history of autoimmune diseases, so maybe you don't get them yourself. That's all I'm going to say. Beyond that is speculative. So I hope that answers your question. Thanks, and for more information go to leanerliving.com, and maybe I'll have some more articles up soon.